Hi, welcome to Nurses Anonymous. Basically, I'll be going over our care plan. Number 1, we'll be focusing on the bladder distension. And what we have is altered elimination, bladder distension, related to the spinal cord injury. Some of the supporting data are a firm and raised pelvic region, output less than 30 cc's an hour. We obviously found a kinked catheter and an overfilled urine container. The nursing goal, we want the client to be voiding greater than 30 cc's an hour into the container by around 1,300 hours. And right now, it's about 1,200 hours, so we'll give them time. A nurse will straighten out kinks on catheter tubing stat. Well, the reason for this is kink tubes obviously prevent urine flow into the container. Number 2, nurse will educate client to check for kinks promptly after fixing the kink. We do this because since the patient cannot feel sensation or distension, they must learn to look for the kinks on their own to make sure that this doesn't happen again. But the nurse will check and or empty urine from the container if needed every 1 hour. A full container will cause backflow of urine back into the bladder, which is just wrong. Well, the goal is obviously met. We fixed the kink and now the urine is flowing.
Hello, my name is Jonah, and I will be talking about a care plan for bowel constipation. We have altered elimination, bowel constipation, related to paralytic ileus, secondary to a spinal cord injury. And it's evidenced by a firm distended abdomen, some impaction, straining, no BM for the past 3 days. For the nursing goal, the patient will pass stool by the end of the shift, November 19th, 2010, today. Nursing outcomes and interventions. Assess the bowel sounds after every meal. Early signs of impaction is important to note so we can intervene earlier. We must check for bowel impaction upon straining and use cleansing enemas if necessary. Paraplegics and quadriplegics cannot retain suppositories because they have loss of muscle control in certain areas. And number 3, provide sufficient fluids, roughly 250 cc's an hour. It's important for proper bowel and bladder function. And yes, eventually, the goal was met.
Hi there, my name is Nurse Kelly, and welcome to Nurses Anonymous. I'll be talking about autonomic dysreflexia, altered neurosensory autonomic dysreflexia related to overstimulated autonomic nervous system, as evidenced by a severe hypertension, pounding of a headache, flushed skin above the level of lesion, piloerection, diaphoresis, dilated pupils, bradycardia, restlessness, and nausea. Now the nursing goal we have is the patient will inform the nurse when signs of autonomic dysreflexia begin to occur. Some of the nursing outcomes we have include elevating the head of the bed to the sitting position immediately. Now, number 2, we check the blood pressure because we want to monitor to ensure the patient doesn't enter a hypertensive crisis. Administer antihypertensive if blood pressure remains high. This removes the threat of life-threatening hypertension. And to me, I believe the goal was met today. And my patient is doing perfectly well now.